Hi, everyone. Welcome to our session on virtual meetings and advocacy days. We're going to give it about a minute or so for folks to join in before we officially get started. Okay, I think that's good. We can go ahead and get started now. So before we officially dive into today's content, I want to go over a few housekeeping items. Next slide, please. One more. Yes, thank you. So this meeting is being recorded. The recording will be emailed to participants with any other materials within a week. Since this is a larger session, we ask that all attendees please mute their microphones unless called upon to participate. Being on camera is optional. We will be taking questions in the chat today. Please feel free to put questions in the chat to everyone or chat me, Ali Rahimi, privately. For the sake of time, we will hold all questions until the end. We'll try to address all questions before the webinar concludes. If you need technical support for the meeting today, please chat tech support from the pull-down menu. We do have closed captioning available during this meeting. You can turn on this service in the menu bar. The recording will also be sent with captions. We very much value your feedback, and we'll have a short evaluation for you to fill out at the end of this webinar. We ask that all participants have respect and allow grace for one another today. Please experience this webinar how you learn best and let me know if there's anything I need to know. Next slide. And with that, welcome to our session on virtual meetings and advocacy days. This session will feature grassroots advocacy leaders who have successfully navigated organizing and mobilizing advocates in a digital space. You'll hear from You're the Cure grassroots managers, Jacob Denniston, Julie Howell, and Kim VanVeen on tactics to digitally engage advocates and connect them to lawmakers during the pandemic and beyond. Slide. My name is Ali Rahimi. I'm the grassroots manager for Voices for Healthy Kids. My role is to help campaigns with grassroots strategies through accessing grassroots networks and providing technical assistance. I will be moderating today's webinar. Slide. So our speakers for today are Jacob Denniston, Julie Howell, and Kim VanVeen. Jacob Denniston is the American Heart Association's grassroots manager for the Midwest region. In his role, he is responsible for managing advocate recruitment, engagement, and mobilization efforts in the region. He collaborates with state government relations directors and volunteers to help pass local and state public health policies. He has a BA in political science and government, as well as international studies from the University of Nebraska-Lincoln. Julie Howell is the American Heart Association's lead grassroots manager for the Southeast region. In her role, Julie works closely with Kim VanVeen to oversee the You're the Cure grassroots network for the region. She is also responsible for developing and executing strategies to recruit, train, and mobilize volunteers in state and local public policy campaigns in Alabama, Florida, Louisiana, and Mississippi, often through collaboration with government relations and communication staff. Based in Baton Rouge, Louisiana, she has a BS in English from Southeastern Louisiana University. And last but definitely not least is Kim VanVeen, who works with Julie as the American Heart Association's grassroots manager for the Southeast region. In her role, she helps oversee the You're the Cure grassroots advocacy network for the region and develops and executes grassroots strategies for state and local public policy campaigns in North Carolina, South Carolina, and Georgia. She has a BS in business management from UNC Charlotte Belk College of Business. And with that, I'll turn it over to Jacob, who will kick off today's presentation.
Thanks, Ali. Thank you everyone for joining today, and thanks Ali and Voices for Healthy Kids team for inviting all of us to speak today. As Ali said, my name is Jacob Denniston. My pronouns are he, him, his. I live in Lincoln, Nebraska, and I am one of our two grassroots managers for the Midwest. So today we're going to be focusing on lobby days and how the American Heart Association, how we kind of switched our You're the Cure network. And if you're unfamiliar, our You're the Cure network is our network of advocates in all 50 states and in Puerto Rico to work on local, state, and federal policy issues to help promote heart health and stroke smart communities all across the country. So we're going to really kind of focus in on lobby days and what our experience was organizing these in the era of COVID-19 and how we switched to entirely virtual events when traditionally we had very public, very active, very well attended in-person events. So if we can go to the next slide. So just kind of level set here for everyone on the call. I wanted to start with talking about what our traditional lobby days kind of looked like. They were held in person. Advocates had to come to the Capitol or to the city or City Hall, or even at the federal level, go to the US Capitol. It included an advocacy skills training over the issues that we're going to be talking about, how to have effective meetings, all those kind of tools to use in the face-to-face meetings that would happen later during that event. It had wrap-up events, we had news conferences, we had celebrations, we had report out type events with advocates and lawmakers and everything at the end of whatever such event. We took photos with lawmakers. There were a ton of media advocacy work that we did with different media releases, interviews, and all sorts of social media, and some post-event activities with other sharing out media statements, successes, stories from our advocates about their experience and all of that. As I'm sure you can tell, COVID-19 kind of changed everything. So after COVID-19 really started to ramp up, the American Heart Association decided that we were going to switch all of our events to digital. So that really put more emphasis on how grassroots managers and the advocacy team as a whole, our government relations directors, our media advocacy colleagues, our communications directors, our community impact directors, our local board directors, everyone on our team, how are we going to keep our volunteers engaged? How are we going to use what digital resources we had to really make sure that we are still not only having the impact that we want to, but provide a good experience for everyone who helps advocate with us. So we really started leaning on all of our digital tools, and we really started honestly experimenting. And today we're going to hear about 3 different cases from myself, Julie, and Kim about how we went about it in our different areas around the country. So we can go to the next slide. When we switched, we really kind of wanted to make sure that we were still holding true to events though. So we had multiple different models. We had a digital day of advocacy, we had a virtual lobby day, and a week of advocacy action. I believe all 3 of those we're going to talk about today. But some of the ground setting that we did as a team and as an association is we really wanted to still make these things feel like an event. Even though we weren't there in person, we still wanted it to have an event energy and that opportunity for advocates to talk to one another, to communicate with another, to build that relationship, not only with them, or with each other, but with us, and making sure that it was a fun and enjoyable experience. So it needed to engage all of our advocates and lawmakers. It needed to be flexible to make sure that we accounted for what state we were in, what community we were in, what advocates we were working with, what the lawmakers were comfortable with. And so we had to innovate a lot, and we had to, all of our different areas had to do different things to meet that. And that we were very responsive to the changing environment that was happening. And then, exactly like that, it needed to have an impact. It needed to feel like an event, not only for the advocates, but for the lawmakers to have the real experience that they would us showing up to the Capitol. So with that, obviously, one of the main differences was we switched to Zoom meetings with lawmakers. So we can go to the next slide. Oh, sorry, top 10 best practices. I skipped a slide, my apologies. So what we kind of came up with after we did an after action review were some of these best practices from across the country. It had to feel like an event. It wasn't just another email alert. It wasn't just another, hey, it's our week of action, click this link, take this action. We need to pre-plan and promote it in any kind of way that we could. So we need to select our dates. We need to do our best so that we were providing that event the same way we would in person. We work with our colleagues. Only do so much, and we have so many people at the Heart Association, I'm sure all of you do, in your organizations, that have so many expertise in working with all of them to make sure that we have an successful event. Flexibility. We needed to meet the needs of the campaign, the state, the locality, exactly what we talked about. Have a kickoff. We still needed that training. We still needed to talk about the issues, what they matter, what were the bill numbers, all of that, to make sure that we provided the advocates the information they needed for these events. The event features, having layered tactics. It shouldn't be one-dimensional. It shouldn't just be one opportunity that's provided. We wanted to make sure that there were many different layered things on top of each other to, again, make it feel like an event. Media advocacy, we needed to include social media, traditional media. You can still have a virtual news conference. You can still send in letters to the editor before these events. You can still make media statements. You can still get stories from your advocates and promote them. Volunteers help with the planning, provide input, and lead some of these events. Some of our most successful events were always volunteer-led when we were in person, and that held true for our virtual events. Has an office hours component. We wanted to make sure that we could talk to them, we could personalize, that you could have questions, you could still build those relationships, and then have a wrap-up activity and have a post-event survey, which is always some of our best practices. That's a quick little rundown. So if we go to the next slide. Great. So one of the biggest changes and one of the biggest feedbacks that we were getting was the meetings with lawmakers were different. Switching to Zoom is new, not only for our volunteers, but for the lawmakers. So some of the tips that I always provided was things to look at before your meeting. Make sure to check your background and make sure that there's nothing distracting. I, of course, chose to take this in front of my clock, which can sometimes be distracting. So I would not take a meeting with a lawmaker here. So check your background, make sure that there aren't any distractions. Try and find somewhere quiet that you won't be interrupted. Some examples I had, it was like, you can go sit in your car, you can find a bench outside, you can find a room in your house, a room in your office, just any place where you don't think you're going to be interrupted, that you're going to have time and quiet to have this meeting. Dress nicely. A lot of us have been working remotely for a very long time, and we get very comfortable not necessarily dressing up for these type of meetings. So it was always good for us to remind our volunteers, like, you want to dress up, you want to dress nicely to have that meeting. And because we're the American Heart Association, I always say wear something red. And then a big perk that I found for this, and that volunteers informed me of, is like, you can have your talking points pulled up on half the page. You can have your Zoom on one, you can have your talking points pulled up in the other. So you can be looking at all your talking points, making sure you feel comfortable, you're well versed in them, and you have that like safety of having that information right in front of you while having those meetings. So I'll get into a little bit of some of those results here a little bit later, but if we can go to the next slide. I want to go into a little bit of one of my experiences. So like I said, I'm one of the Midwest grassroots managers. So I have 7 states. So I'm going to highlight Minnesota Digital Lobby Week, where we did this format very similarly in 4 other states as well. We did it in Iowa, Missouri, Kansas, and Nebraska. Obviously, we're a little short on time, so I'm just going to do Minnesota's for today. But so you can see kind of the schedule here. I decided a week of opportunities to help provide a little bit less amount of time each day. So no one needed to take the day off comparatively to a normal lobby day. You didn't need to commit to that. You can do little pieces each day. So Monday, we hosted a training and a kickoff call that lasted 45 minutes, an hour. And then they received an alert from me offering to tweet a lawmaker that, hey, it's our digital lobby week. Here are the issues we're going to do. Can't wait to talk to you later this week. Tuesday was emails to lawmakers, very much like our normal alerts. Wednesday, we had meetings with lawmakers or phone calls to lawmakers. We offered either one. It's those layered tactics that we talked about earlier. Not everyone is necessarily comfortable with having a meeting, or not everyone could necessarily commit to a 15 to 30 minute time frame during the day. While some of them were still working, some of them did this over their lunch hour, some of them, had a morning off, or were able to take 20 minutes to have this meeting at work. They couldn't necessarily commit to that time. So I set up a campaign where you could call your lawmaker and have leave the message or talk with a staff member during that day to give the same message that the meetings with the lawmakers were having. And Thursday we did share your story. So taking a few minutes to record a video or write why you're a volunteer with AHA, and really go into that. So this was just kind of the format that we chose. It also lets advocates choose where they're at on the ladder of engagement. I wanted them to have time and the ability to pick what actions they felt most comfortable with. If they felt comfortable sending a tweet versus having a meeting, or if they sent emails to their lawmakers, they're good with that, but they weren't quite ready for a meeting or they couldn't commit to it, but they could do a phone call. They could pick and choose what actions they had time for and that they felt comfortable through the week and still made an impact as the overall group. You can go to the next slide. So how we kind of came up with this, some promotion engagement that we did. We have an advocacy committee in Minnesota that is just phenomenal. Wow, words are really hard, phenomenal. And they are volunteer leaders that I really leaned on, and I asked for feedback. I wanted ideas, and I really early on, almost 6 months in advance to the event, was talking to them about how this should go. So all of them provided self-made videos of their stories that we could share, that other volunteers could look at and be like, wow, these are our volunteer leaders. And these are the leaders of our organization. And they could be looked at as examples. They were shared with lawmakers. They provided input on our schedule and the different actions and provided me feedback on all of that. I, of course, as they are the leaders of our group and we're kind of leading this, I gave them a preview of all the materials I was building, the training, all the actions, and kind of confirmed everything with them. I spent a lot of time talking to our communications colleagues who were incredible. They created different social media graphics to promote this online. I believe it was 2.5 months in advance. We started promoting it online and sending out invites for it. They shared the schedule, sign up page. We created a text to RSVP, which we handed to our volunteer leadership to spread throughout their families and everything. We actually saw a really good return on people texting to RSVP versus signing up on the link to RSVP for these events. We sent press releases out about our issues and that we were still going to hold this event, even though there was COVID. We're going to hold it COVID friendly and keep everyone safe while still advocating for the health issues that are even more relevant today. We shared advocacy programs we shared advocacy stories on all of our platforms on Instagram, Facebook, and Twitter that the Minnesota AHA has. And we had different advocates on each different platform sharing their stories, the reasons why, their experiences of the week and everything, really helping us create that buzz. And then communications helped. They presented on our training. They taught people how to record their best videos and best practices for creating videos and LTs and all of that kind of communications work that obviously they are way better at than I am. So we can go to the next slide. So here's a little bit of what we did. The comms group put together a GIF. If you know me, if we've talked before, I love GIFs. I am very supportive of these. So we created a GIF that we were sharing on all of our different social media platforms with the text keyword, the text number was your first action. Join us for our lobby week. Second one is follow our different social medias on other platforms if you don't already. And then action 3 was to get one person to sign up with you and to do all of this action with you. Go to the next slide. Some other digital promotions we did. See there, we did the dates, their digital lobby week. We're offering a series of different digital actions throughout the week, really trying to promote that, hey, we're going to be safe about this, but you can still do this, your voice matters. And then we had the schedule on the right with a picture of the previous year when we had the lobby week or the lobby day in person. And then of course, like we did in person, we encouraged our advocates to take pictures with their lawmakers over Zoom and post them on social media and tag them, thanking them for the meeting. Thank you for talking to us and helping them build that information or building that connection and providing that feedback for the lawmaker. To the next slide. Coalition coordination, we worked with the Minnesotans for Smoke-Free Generation, who scheduled their digital lobby week the same week as ours. I think everyone here can agree on this. We don't work in a vacuum. We work with so many partners that care about these issues and we want to work together. So you can see on here, because we were doing this the same week, we coordinated on so much. We were talking about a lot of the same bills. We had an additional priority that we were talking about that the coalition wasn't. So we talked about coalition's priorities, which are ours, and an additional for us. So we coordinated on all the timings of the action sent. So if you were participating in both, you didn't get duplicate actions at the same time. We weren't working against each other. We communicated on what actions we were taking each day to coordinate the buzz in the state and in the legislature itself. Messaging on all of our tobacco issues. We used the same hashtags on our tobacco issues. So we coordinated with where we were focusing our volunteers to make sure that we were covering all of our targets in the legislature. We were sharing who had meetings with what lawmakers. The coalition had their meetings the day before, so they set up time with us later that evening to tell us what were the feedback on some of our key lawmakers that we had advocates going to that next day. And that gave us an opportunity to inform our advocates, hey, they had a meeting about these issues yesterday. Here's what they were pushing back on. So if you could focus in on this part, or like, we know that this talking point really got far with them. So if you wouldn't mind highlighting that again today, that would be incredible. And sharing our best practices. We can go to the next slide. So just some quick results. I'm very data driven, as is everyone on our team. So we had 54 RSVPs, 23 of which attended our training that we did on Monday. 25 sent tweets to our systems, and then there were some additional organically who retweeted us or just naturally did their own tweets in support of it. We got almost 100 emails sent from our advocates. We got 57 face-to-face meetings, video meetings with lawmakers in a 4-hour time period we put up. We got meetings with 47 lawmakers via Zoom or Teams. Our recommendation for that is just find out what the office is comfortable with setting up, what you have access to, and really just being open about that conversation about the technology. And then I know that we had at least 6 additional calls that were called into offices for that. And we had 9 spokesperson opportunities who wrote LTEs before and after the event or shared their stories online, and it got picked up by news outlets and all of that. So I think there's just so much that can go into it. And I think coordination would be a big thing that I would recommend for everyone. And stick to your plan and and just have faith that it's going to go well. So I'm going to turn it over now to Julie Howell, who is going to kick off the next section.
Thanks, Jacob. I appreciate it. So, hi, everyone. Thanks for having me today. My name is Julie Howell, Grassroots Manager for the Southeast. And in my role, as Ali shared earlier, I work in Mississippi as part of my role. And normally in Mississippi during session, we'll invite a small group of advocates to the state capitol to meet with legislators. And it's a good way to continue developing relationships with lawmakers. And then other times we might invite volunteers across the state to join us at the state capitol for a coalition event. There are a lot of obstacles we incur at that state capitol in particular that makes having an annual lobby day a bit of a challenge. For example, parking is not the easiest. So if volunteers don't even want to struggle with trying to find a good parking spot near the capitol, or if walking a long distance is an issue, then right off the bat, volunteers do not want to travel. Also, even if you got volunteers to the state capitol, there's no meeting space for you. So you would be gathering in hallways, which is very uncomfortable, particularly if you had a large group. Another obstacle we incur is that lawmakers do not have their own offices at the state capitol. So if you're able to get a meeting with them, it's perhaps in the hallway, right? So we wanted to revamp the volunteer experience to begin with for a state lobby day within Mississippi, and conversations had started and then COVID happened. And that just propelled us to go ahead in the virtual realm, which was super exciting for us and we welcomed it. So we hosted a Mississippi Digital Day of Action on February 11th earlier this year. And we decided to focus on 2 issues of ours, which coincidentally are voices issues as well. One was water access in schools, and the second was SNAP's incentives funding. And honestly, as Jacob touched on throughout his portion of the presentation, this event is a true team effort between government relations, grassroots, and communications. Next slide, please. So I'd love to talk a little bit behind the scenes for that pre-event work. We really thought about it in 3 buckets: pre-event, day of, and post-event. So together as a team, grassroots, government relations, and communications, we talked about our vision, our goals, and our strategies, and developed an action plan. We created a document for this action plan to hold us accountable that had clear roles and responsibilities and deadlines. And we scheduled regular check-in calls to make sure we kept the event on track. Because as Jacob touched on earlier, once you set that date, we really want to stick with it. And we did not want to change it. And through those conversations in the pre-work, we had conversations about our goals for volunteers. Like, we wanted to increase accessibility, because in the past with an in-person event, what we often found is that people in the Capitol area would be the only ones willing to make the drive to attend an event at the Capitol. So we wanted to increase volunteer engagement across the state. We also wanted it to be accessible, and we wanted to build a sense of community, like Jacob touched on. We want it to feel like an event, right? You're not alone in it. It's not just an email that you're responding to. On the policy side, we wanted to identify what key bills could volunteers have the biggest impact on. What was the legislative calendar looking like? Was there a big deadline coming up? So for us, we decided to focus on a floor deadline, meaning the bill had to pass their floor to continue through the process. And we also, then we're like, well, darn, we're talking about 2 different issues. How do we have one event on 2 different issues and have it be a success? So next slide, please. I'm sorry, you can stay right here. Yeah, next slide. Let's see. So for pre-events, I'm sorry, you could have stayed on the other one. I forgot how long that one was. So once you had the pre-work solidified, it was time to go to phase 2, which was developing the content. So for grassroots, that meant I was making an event website page that included registration, information about the issues in the bills, the text to register option. I was starting to draft the email invitations and even that day of event messaging that would go out. We're prepping our post-event survey ahead of time. Communications was getting ready to set up a Facebook event page. And we're working with them to record videos of staff as a thank you message for a post-event. So we were developing content. And then when the invitational piece of it was ready, we were able to go to step 3 and roll it out. So we ended up inviting You're the Cure advocates to register for the event. We also had created a promotional toolkit to share with Voices for Healthy Kids sub-grantees, so they could promote it to folks that would be interested in SNAP incentives funding specifically. And then we were able to launch in the Facebook event page and have some Facebook ads to promote the event. So that was all ahead of time, was our pre-event work. And that pre-event messaging, of course, we did our You're the Cure alerts, talking about the importance of the issues and the timing of the event and asking folks to register. After they registered, they got an auto reply email saying thank you and all the details needed, and please share this with your family and friends. And then communications, like I said, they were working on the Facebook event page, and they were working on this Facebook ads to targeted audiences, because we determined that there were 2 different audiences that we wanted to message on, first water access versus SNAP. Next slide, please. And then the event schedule. This is where we landed, trying to blend 2 issues into one event. So we started the morning with a virtual kickoff that included a quick issue training and bill overview and talking points and an overview of the day. And after that, we hopped offline, and then we went ahead and we had all these alerts and Facebook posts scheduled. So we were able to message advocates that morning on SNAP, and then invite them to our office hours at noon, and then focus our afternoon messaging around water access in schools. And next slide, please. And then also communications. While we were messaging day of event to registrants, communications was mirroring our messaging on the Facebook event page and through their ads as well. So you'll see some Facebook posts that we had on our event page that were driving to those timely calls to action. And because we were coordinated, when a You're the Cure alert went out, that Facebook post went up. So it was beautiful. And the various calls to actions were to email, call, and tweet key targets for both issues. So everything we did in the morning, we pretty much flipped it for the other issue in the afternoon. So if someone wanted to only advocate with us for SNAP, That would be the first half of the day. If they only wanted water access, it'd be the second half. And office hours was for everybody along with the virtual kickoff event. Next slide, please. And then after the event, we did a thank you email right afterwards that afternoon to everyone who registered. And we were very cognitive of the language. So we're thanking people who participated. And if they were unable to participate, we gave them a way to let their voices still be heard. We also sent out a post-event survey to get their feedback because that was our first real digital event in the state of Mississippi for advocacy. And then also on social media, we did thank you messages to our legislative champions that were well received from the members in their offices. Next slide. Results. So Jacob, I got you. Here's my data. So we had 95 RSVPs and 142 Facebook responses. And unfortunately, it did not translate over well to actually the number of people who participated. So that is something that we are focusing on how to improve moving forward. Also, we noted that our highest open message to generate registration was exclusive. So they liked that personal or exciting subject line. And I know subject lines can be so hard to write, but they are so valuable. Also, after the event, we did receive a lot of positive feedback from participants. And we were able to see that we did reach a broader audience. So in our survey, we asked for optional information relating to some key demographics, just to see if we were engaging volunteers outside of Metro Jackson and outside of folks that normally engage with us. So that diversity was really important for us, and we started moving the needle. So we're very excited. And then on the policy side, we were super thrilled too, because we did meet our policy goal, which was to get our bills to live another day and survive the floor deadline. And then next slide. All right, so now I would love to turn it over to Kim VanVeen. Kim.
Thanks, Julie. Hi, everybody. Thank you so much for joining us today. We're excited to be able to share in a little bit about what has been happening in the Southeast, specifically right now, about what we did for our North Carolina Digital Day of Action this year. So if you will go on to the next slide for me. Perfect, thank you. So we actually had two asks for our lobby day this year, our virtual event. One of them was to close the health insurance coverage gap in the state of North Carolina. And then the second was to invest in tobacco prevention and cessation programming in our state budget. So we kept it pretty simple, even though those are really detailed asks. For the advocates, we made sure they felt comfortable, and we did that by having a virtual kickoff in the morning. We had an issues training that morning. We went over the daily schedule. We were, and by we, I mean myself and my government relations director, who I actually believe is on this call, Sarah Jacobson, but we actually went over our day agenda, and we made sure they understood how to use the technology as well. We did a demo on the screen because our call to action was a phone call. So we wanted to make sure they felt comfortable with how to use the system. So if you have something like that that you'll be using for any sort of an action day, definitely suggest demoing. I think that makes a big difference. So we did all of that during our virtual kickoff. And then we had email reminders scheduled to go out incrementally throughout the day that outlined what the next step of action would be. So they got reminders the day before the day of action that the training would start at a certain time. We held the link until that day and that time so that the email didn't get lost in their email. So they got a fresh link to the daily training with a reminder of what time it started. And then on top of that, we sent them another reminder right before the training started. And then we sent them a reminder when the actions were supposed to start with the link to the landing page where they would be connected through our system. So it sounds like it's a lot of emails, but it was a really great way to make sure not only did they feel prepared because they knew what was coming next, but it gave them the technology in a way that they weren't overwhelmed, and they knew that the next step would be right before them when they were ready to take it. So we did that for our actions, and then we had a celebratory wrap up with everybody who wanted to return back at 2 o'clock that afternoon. And typically for our in-person events, when we are able to offer them, we'll do that anyway. So we wanted to try to offer as much consistency as we could, understanding that these events are kind of our capstone events within Grassroots. And so we wanted to make sure to try to provide as close of an experience as we could to what they're used to. So I know in North Carolina, we do a very robust event in person. So we wanted to make sure to try to mirror that with what we could offer them digitally. So we also offered one Zoom link for the whole day. So we encouraged them just to keep that link handy. I think that made it a lot easier because instead of them thinking, okay, well, at 1 o'clock I need to do this, and at 2 o'clock I need to do that, they had the link readily available all day. And we also encouraged them to keep that link live if they felt comfortable, the Zoom room open. So that way, if they got a call or if they got a question, from a lawmaker, they were able to jump right back into the Zoom room and chat with either myself or my government relations director, get an answer, have some clarification, whatever it is that they needed, and then jump back to the conversation with the lawmaker. So I also feel like that provided that safety net. So if you have new advocates who haven't participated before, having that available to them, I think made a big difference. And we actually use that as a best practice and used it in my other states that had digital events as well. So highly recommend doing that if you're considering it. Next slide, please. So we had a good size event, considering that the digital days of action aren't something we're totally used to doing. So I think there was a little bit of hesitancy, but we had 45 RSVPs. Out of those 45, it varied throughout the day, but we had 15 advocates make 27 legislative connections via phone calls. So those to us are high priority actions that we really see moving policy. So definitely suggest that if that's something you're considering. We received positive feedback in our post-event survey, which I know that my colleagues before me have already mentioned, but I definitely find a lot of value in doing a post-event survey. I'm one of those people that really enjoys constructive criticism. So for me, it was really helpful to see where we might have had some holes and where we were very strong in a digital sense, because none of us really know what's going to happen next. So it's really nice to know what advocates like to see and what they've enjoyed in that digital space. So we received very positive feedback from that. We reached a broader audience because my government relations director helped me to make sure that our metro boards, our metro volunteer boards were available and were invited to participate with the event, which I think was great because it was a higher level of engagement opportunity for them. And it was great for our grass tops advocates who have enjoyed building those relationships with lawmakers. So we definitely were able to kind of extend the reach. And something I know that Jacob mentioned earlier when he was talking about digital meetings, I'm one of those glass half full people, and I've loved offering digital events because I have found that advocates are much, much more comfortable on their, for lack of a better term, on their home turf. So they're in familiar settings, they're comfortable with their clothing, and they feel like they have a little more control over the meetings. Whereas when they're meeting in person with lawmakers, it's very much on the lawmakers' comfort level in their offices with their legislative staff. So I really enjoyed being able to offer a digital opportunity to those advocates who may otherwise not have engaged with us. And the other thing is those advocates now have had an experience of doing this digitally, where if we pivot and start offering in-person meetings, now they have the experience where they are comfortable going in person. So it was a great way to reach advocates who might have had some hesitancy or who just schedulally wouldn't have been able to join us because of the time commitment. So it's a lot to take a full day off from work to engage with a lobby day. And while there's a lot of value in doing it in person, having a digital event made it easier for them to fit it into their work days. So they were more likely to engage. So I found those to be some really big positives about that. I know I mentioned about here, it's a great way to engage new advocates who might be nervous about a lawmaker meeting. And then again, I highly suggest using one singular link or one singular landing spot for advocates to come back to so that they don't feel like they have a lot of pieces that are moving, which they then have to save and go back to. It's just a lot easier to offer one place for them to crash. Next slide, please. So I also recommend doing a thank you email to participants. Julie had mentioned that they did a thank you video, which I thought was a great idea. If you're not able to do that, or you don't necessarily have the legislative champions that you want to really focus on, still doing a thank you email to participants from the grassroots and the government relations staff is great. If you can mention any movement in the policy asks that you had, for example, I wish I could say this, but if our North Carolina MedX policy campaign had passed, it would have been wonderful to offer that as an update. Because of your participation with our lobby day, we're so happy to report that XYZ. So if you have that good news to update advocates with, that can also move it along to where they feel like and they see how directly impacting their testimony and their asks of lawmakers were. So I find a lot of value in doing those follow-up emails as well. And just add a couple of pictures of you and your government relations staff and make sure that they're represented as well. But sending that thank you, that personal touch is something some people just don't think about, but it really makes a big difference. So that, and then again, we recommend the post-event satisfaction survey. Those are just really great ways of finding out where you might have had an opportunity that you didn't recognize, or where you can just continue to do what you did because you did it well. So those are some really good things to remember. Next slide, please. Okay, so we realized that not everybody might have the capability to do what we call text to join, but we wanted to demo something that we have found to be incredibly valuable. I know Jacob mentioned that he had engagement and RSVPs through text. So we wanted you to see what that looks like. So I always make this joke when I could do in-person trainings and say, typically we encourage people to put your phones away. We want you to stay engaged. Well, today we want you to bring out your phones. So if you will go to your a new text message and type in the 2 is 46839, and then the message is cure. If you'll type that in, that's our generic text to join campaign to join up with our advocacy network here, the Cure. So if you'll do that, you'll see a bounce back of a link, and then that link will take you to a landing page where you can auto-populate your information. You can opt into texting, you can opt into emails, and it's a great way to get updates about our advocacy work at the American Heart Association and find out what's moving in your local area, because again, we do local, state, and federal policy campaigns. So there's always something moving, and there's a variety of different issues to get involved with. So we just wanted you to be able to check it out and kind of see what it looks like to do text engagement. Not everybody is going to want to engage that way, but we have found that there are certain advocate groups that prefer to engage via texting, and then there are some that just prefer to engage via email, and still, there are some that prefer to engage via phone call. So this is just one way to reach a segment of your advocacy population. The link will also offer a way to share your personal story with your lawmakers and your community, and it gives us as grassroots staff the opportunity to see where we have unique stories that might be a great fit for some of our policy campaigns. And then last but not least, you will definitely receive invitations to any free advocacy trainings and events that we might have in your area. So we encourage you to go ahead and jump in there and just poke around. We'd love for you to see what it is that we do within You're the Cure. And then next slide, please. Okay, so just a couple of things moving forward. I realized there was a lot of really great content that has been shared before me. So this might feel like a repeat, but bear with me because we wanted to emphasize a couple of these ideas that have really made a profound difference in what we consider a really good digital experience with the American Heart Association. So we have to focus on improving recruitment efforts, and we have create educational campaign videos to identify how to meet volunteers where they are, which is key, whether it's geographically, whether it's what their interest levels are. Identifying how and where you can meet somebody where they are will always ensure that you have an engaged and passionate volunteer. Surveying advocates to gauge interest is really key as well to understanding that full picture of the advocacy base within your network. Host timely trainings, including a Zoom meeting versus a Zoom webinar, and then hosting in-person events with an online option to attend, understanding that currently the American Heart Association is not offering in-person advocacy events. But hopefully, if you are doing digital engagement, you've picked up some good suggestions today of things you might want to try for your own volunteers. So who knows? And next slide, please. Okay, so at this time, I will pass the microphone, so to speak, back to Ali.
Thank you, Jacob, Kim, and Julie for your very informative presentations. We do have time for a few questions. And as a reminder, if you do have questions, please post them in the chat or send them directly to me in the chat. Our first question comes from Don. So he asked, was there any concern with public promotion of the lobby that the lobby day might draw industry moles who might share their own messaging using our event? And how did you screen the people who signed up for the event?
So specifically for Minnesota and the other events we held in the Midwest and everything, people who RSVP'd who wanted to have a meeting and everything had to RSVP and give us their information at least a week in advance, and we were setting up those meetings for them. So we knew 90% of the advocates who had already signed up to have those meetings. Specifically in Minnesota, we set up that we had one member of the local staff who had felt comfortable, who had engaged in this on every meeting, that the government relations director was attending key meetings with newer volunteers, or leaders of our advocacy committee were sitting in on those meetings. So we really tried to make sure that we had an assigned leader in each one of those meetings to make sure that not only everyone felt comfortable, but to kind of avoid that situation.
Thanks, Jacob. Julie, Kim, any input there? If not, we'll go to our next question. Cool. So this one comes from Jill Birnbaum. how do you see virtual events complementing in-person events in the future? How will virtual events change, if at all, once in-person events begin again?
I can take this one. So that's a great question, Jill. I know a lot of us in the past have tried to have a digital element to our in-person events. I know our collective manager, Betsy, is very big on offering a digital piece when you have an in-person event, like a lobby day. So I know, at least for mine and Julie, for our region, I do anticipate that we'll still have a portion of that, because I think understanding everybody's comfort level right now with COVID and taking health precautions for themselves, I think a lot of people might be hesitant to engage in person anyway. So it's going to be key to have that element where maybe it's, instead of an in-person meeting where you're visiting with lawmakers, maybe you have the phone calls, maybe you offer a digital meeting with a key decision maker, and that's where you invite the people who wanted to join digitally. There are ways of being flexible, and I do anticipate, and I can't speak for Jacob and Julie, obviously, but I do anticipate trying to include, at least for our larger capstone events, I do anticipate trying to have a digital element to it.
Yeah, I'll add to it. So for example, what I'm thinking of as well is if you have guest speakers for your in-person event, are you able to record them and then share them with folks that want that digital participation option so that they can watch it after the fact on their own time at their convenience? So we are thinking through ways on how to take parts of the in-person event and package it a little bit differently for folks who are not able or interested to attend in person, but still engage online.
Yeah, I'm gonna jump in here too, because I think Jill gets exactly to the heart of what all of us are talking about for this next year. If we can start doing all this, some of the feedback I got from my advocates were, we had one specific long-term advocate in Minnesota who said that she just, due to her personal life and everything, wasn't going to be able to engage very much, wasn't going to be able to participate very much. And then the virtual lobby event came up, and she lives in rural Minnesota, and she took action every day, and she set up a meeting and everything. Even though 2 months prior to that, she said she was going to be stepping away and not participating anymore just because of her own time commitments. So I think this is also going to allow us to be a lot more targeted. I got responses that if a lawmaker wasn't right in the committee, if they weren't a target, they weren't in the committee for all of our issues or anything like that, maybe they could have a virtual meeting versus being in person, versus if they were in leadership or in the right committee, bringing people to the Capitol to have that conversation with those specific targets, so we can be really strategic about where we're putting our resources, where we're spending our time, and all of that. So I think, exactly to Kim and Julie's point, we'll be able to coordinate that a lot better and really make sure we're spending our capacity where it's going to have the greatest impact.
Thanks for that. I have one, I guess we have time for one last one. It was sent to me directly. During the pandemic, we've seen an increase in digital correspondence resulting in email or Zoom fatigue. Have you had to change the messages you use to mobilize advocates?
I'll jump in.
Yeah, Julie, go.
Thank you so kindly. So yeah, we've increased text messages outreach. We understand that a lot of companies, there's so many emails being sent to people, and to have yours be super important and one of the ones they read is very challenging at the end of the day. So we found text messages to be helpful. We've also focused on the quality of our emails and the timing, like we're very hyper focused on it nowadays as well. So really taking a look at that subject line, making sure emails are concise, they're captivating the moment you read it, they're still easy to scan, they're visually pleasing, and they are timely, because we don't want to message volunteers for something like just to do it. We want to make sure that there is a sound reason and really good timing behind it. So Jacob, I'll toss it to you.
Yeah, no, I everything you just said, Julie. And I think I would add, what was interesting is we were kind of surveying our network as to that early on in the pandemic, and we actually got a lot of feedback that they wanted more messages from us, which kind of shocked us early on. But I think it's the way you decide to engage, and exactly what Julie said, like the content of the message matters a lot, and that we're giving relevant, wanted and concise information to them. And we're not just messaging them to message them. They are a part of this group. They are getting information that they are looking for.
Yeah, and I'll add one thing to that. So I know that I think intentional is the word to use here, because we're all of us, even the ones of us on this call, not just our advocates, are tired, I think, of meetings, and we like the breaks. But it's something that Julie and I did try that I think was really beneficial, was that you want to meet advocates where they are. And I know we covered that, but we also started recording our calls and including that in a follow-up email that we sent to our advocates, which sounds like an elementary thing to, everybody should be doing that, but we really weren't until. So that way, if somebody had a day where they'd RSVP'd for a call or a training or a meeting, and they're just like, I can't handle another call, I need a brain break, they would be able to still watch it on their time, and they would see a summary recap of what the talking points were and what the big takeaways were, all in that follow-up email. So, and then again, they can do it at night. They can do it with their family. If they have a friend that they want to share it with, all of the resources are in those follow-up emails that we send. So, and it's not for everything that we do, but it's for our monthly recurring trainings and meetings and things like that. So I do think having something like that you offer, where there's flexibility in when they view it, has made a big difference as well.
Right. And I'll add to our relationship with communications, and the ability to coordinate well with them has been very instrumental as well.
Great. Thank you all for your answers, and thank you all for your questions. If we can go to the next slide. So I posted a link in the chat to a registration for our next training in the series. So this one will be held on October 28th, and it'll go over how to get the most out of your network by keeping supporters informed and engaged on your issues. You can also register using the QR code on the screen. And again, the registration link has been pasted in the chat. And we also want to remind you to save the date for our slate of webinars in November and December. Advance one more slide, please. We also have a short evaluation that we ask you to please complete. You could use that using the QR code, or I will place a link in the chat for that as well. Thank you everyone for your time. And again, we really appreciate your feedback. It really helps us inform our trainings moving forward. Thank you all.